Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdulrahman Alatawi from Saudi Arabia. It's my pleasure to participate in this conference. I'm participating with the paper titled The Determinants of Change Management in Healthcare Industry, a Systematic Review. The change management concept is an essential, rapid terms that has been debate among the healthcare practitioners. In healthcare, they are adapting the new technologies that assist in providing a better service to the society. In this term, the global healthcare is now under the pressure of how they can benefit from the rising in technology demand. In this regard, effective change management is no longer a peripheral concern. It is a strategic necessity. Without structured approaches, digital innovations like AR or EHRS often lead to disruption, staff resistance, or implementation. This paper aims to identify key factors that enable or hinder change in healthcare organizations, examining the interaction between technological, behavioral, and policy dimensions toward the change management resistance reduction, integrating findings from a diverse healthcare settings and to a unified framework. Support the design of more effective people-centered change strategies. The data source of this study based on Scopus Web of Science, Senali, and Google Scholar. This several database used to retrieve the most relevant healthcare change management applications during the target period of this study. Several inclusion criteria has been applied, such as empirical or review studies in healthcare settings, focusing on change management, leadership, digital transformation, or policy reform. Screening, title abstract screening, vortex eligibility reviewing. The final selection is a net of 30 studies. For the process, the systematic review was based on Prisma. As we can see here, the first screening resulted in more than 1,900 articles. After removing a duplicated of 288 articles and investigating further for the inclusion criteria, a net of 30 studies included in this qualitative synthesis. Here we can see the summary. Most of the studies included in this review is a quantitative survey with a percentage of 33. And most of these studies focusing on digital transformation. And the thematic focus, as we can see, is a Western perspective. The key determinants found is that most of these determinants related to the change management in healthcare industry could be categorized in 5 key factors. The digital transformation, organizational readiness, leadership and culture, psychological factors, and finally, policy and governance. This can conclude out that the effective change management relies on organizational outcomes that improve performance and surface coordination through structured digital implementation, but in tying up to the workforce, job satisfaction, emotional resilience, strength the ethical leadership toward the change management reduction. In conclusion, change management in healthcare is multidimensional, requiring alignment across technology, people, leadership, and policy. And the success depends not only on tools and strategies specifically of the new technology, but on staff readiness, trust, communication, and leadership. The new era of digital transformation acts as a catalyst, but without cultural and behavioral alignment, implementation often fails. This leads to the final insight. Sustainable healthcare transformation is not imposed. It is co-created by leaders, staff, and system working together. Thank you.